And so at that point, they don't know really what's involved or if they want to be or not want to be. So let's look at that. If the public guardian takes over the conservatorship of the person or of the estate, then they'll be able to place the person in a state-approved facilities. It's less stress on the family member because the public guardian will also be the payee. The Social Security SSI benefits will go to an account that's managed by the public guardian. And you're not going to be the one that your loved one keeps coming to demand more money. And you're maybe especially afraid that they're going to ask for monies for things they shouldn't be buying. And so you don't want to give it to them, but they just won't take no for an answer. This, by having the public guardian in charge of that, that's not something that you'll have to deal with. The downside of not being the conservator is that you won't have the involvement with the recovery process. You're there to see the recovery of your family member. You'll basically see that the treatment is working well or not working well, and the public guardian isn't there every day or as frequently as you will be to observe that. And you have no control over medications at all. In fact, you won't, unless your loved one comes to you and says, these are the medications I'm on, you're not going to even know what medications they're on. If they decompensate again for some reason, you're not even going to be aware of what hospital they can be placed in because of the HIPAA laws and so forth. So you should work to establish a working relationship with a public guardian. A lot of people are in a position where it really would work best to have your loved one put onto a public guardians, to have them be the conservator because of different circumstances. But there again, the public guardian, isn't going to, run out and buy them a new pair of shoes, take them places and do things. But then the flip side again is that if they're on a public conservatorship, you can be there to provide and bond and heal a lot of maybe past wounds and frictions that were taking place when they were when they had decompensated. So it's something that you need to consider. I've written the pros and cons on conservatorship. If any of you want to contact me with the information that you've been provided, I'll be happy to share that and it'll elaborate more on this slide.
Jim, if I can interject.
Sure.
If the public guardian is a conservatorship, takes it over at the very beginning, you do not have to wait a whole year to become the conservator.
Right.
You can request to become conservator, month, 2 months, 3 months down the road, or vice versa. If you become the conservator and you go, oh, this is not working, you can request that the public guardian take it over. And it only takes about a week, maybe 10 days to get that done through the courts. It's not a big deal and it doesn't cost you anything.
So let's look at the next slide on should I be the conservator? So again, it's you'll have direct contact with the doctor. You can share the mental health history that you've written if he doesn't have it already. You're there to talk about the medications. Again, the upside of it is you can reject inappropriate treatment, facilities, medications, treatment places. For example, my learning curve says that if my loved one were to ever end up in a hospital again, and they decided that the appropriate placement for him would be in a facility, I won't mention their name, don't like lawsuits, that is a step down, I would not allow that to happen, primarily because the facility that I'm thinking of at the moment that is a step down has a major problem with drugs throughout the entire facility. And so there's lots of reasons why you should want to be the conservator. But then the negative side is that your loved one, the conservatee, is always manipulating you, begging you, please, can I just have a little more money? Please, won't you do this, do that? And you're thinking, no, I don't want to do that. And it's really hard to say no sometimes. And I'm thinking, the guys they get through this a lot easier. No, it's not easy for any of us. Again, the negative is hospital will try to push you around and discharge the patient to a facility not appropriate for the level of treatment needed for recovery. So if you're the conservator and you can present a valid reason as to why someone should not be put into a facility that you don't feel is appropriate for their recovery, you have that right to reject it and say, no, it's not appropriate.
Jim, if I can project, that's the law, but by law,
Right.
if you are the conservator, they are supposed to honor your request as best as possible for where to place them. I'm going to just say a couple things. If you are the conservator, you are not held liable for anything. Unless, let's say, you give the keys to your loved one to go run to the store and grab some milk, and they've taken their right away for driving a car and it hasn't been reestablished, and he has an accident, you would be liable. But if he took the keys and did that, you would not be liable. The other thing that I would like to say, if you are not the conservator and the public guardian is, please be respectful of the public guardians. They have, each person can run 50 to 75 people that they're dealing with, and every day. So if you call the public guardian and you start talking and talking, they don't have time for that. They are very busy. They have a lot they have to do, a lot of reports they have to take care of. Be extremely considerate. The other thing is they will have so many days in the office. The rest of the time, they're out in the field visiting patients. So if you call them and you don't get a call back for 2 or 3 days, understand when they're visiting their patients, their mind is on their patient or their clients, not on you. So you want to kind of let that one go. Okay. Working to establish the relationship. We did that. Okay.
Normal LPS process. I think maybe we could skip this because Connie's going to cover it.
Let Connie do that. Yes.
Right, let's go on to the court hearing.
Okay.
Okay, so primarily in the court, the patient's given a assigned public defender. So the patient can request a court hearing, let the judge make a decision. Remember, we're in a 5150, maybe going into the 52 process. It's going into 53, and now we're that starts what's called a temporary conservatorship or a TCON. And in that process now, the patient, when he goes in for the court hearing, can request that a judge be the one to make the final decision, or they can say, no, I want a jury trial. And patients' rights will advise them on this. Believe me, your family members can be pretty well educated about their rights and what they can request. But then also keep in mind too that I've had times when my son says, I'm not going to contest this. If my dad wants to be my conservator, I'll go with that. And just, it's an automatic at that point. And I was a conservator for the remainder of the year. But these are their rights. They can request all of these things. Don't want to get too much more into this because I think Connie will be touching on some of that a little bit on the court hearing. Let me see here.
A mental health court. The next slide.
Yeah.
Yeah, the mental health court, if you're coming and listening, the mental health court is basically in Hollywood right now. It was on San Fernando Valley until the building collapsed in the middle of court. The roof came down. Then they moved to Metropolitan, which was there for quite a while. And only recently have they moved they have their own courthouse now, which is, and they don't call it Court 95, which is, you might hear people talk about Court 95. It's Department 103. So just so that I'm just kind of going over different things that you might hear other people talk about. So it is Department 103 and it is in Hollywood, and that's the address. After the LPS is granted, the hospital's supposed to hold the patient until a proper facility is found to put the patient in. And generally it's an IMD because they're a flight risk. The intensive care division does the investigation and request facilities for them. You don't have to worry about that, but you should go and talk to every one of these facilities. You know your loved one the best. Make sure that it is a proper place for your loved one, that it's going to work out the best for them. The level of care is determined by the clinical recommendation. The normal flow is you go from an IMD to a step down, now called enhanced residential housing, a board and care, sober living, or outpatient. Does not mean you have to go in that order. When the person is in the hospital, that is the time to work really hard to find out what medication works the best for your loved one. A lot of times when they get on a medication that works for them, it's like the difference of day and night. And they could probably skip the IMD and go to a step down or even an outpatient where they're getting outpatient treatment. But don't rush these processes because their mind needs time to heal. And you want that to happen. So just kind of take it easy on those things. I think Connie's going to go over some of that also. Remember, next slide. Once you get the LPS conservatorship, I want you to get the family album. Remember what they were like before they got sick. And that will be your target goal to get them back to that person as close as possible. Medications, be familiar with every one of their meds. Now, keep in mind, your loved one has a serious mental illness. If you have a migraine headache and I have a headache and I go, here, take my Tylenol, it will help you, probably won't even phase your migraine. It's the same situation with medications. A lot of these doctors will give Prozac, Adirance, all these other things to people who have a serious mental illness, and you go, they're not getting any better. They seem worse. You need serious medications for them. And I am not a pharmacologist or a doctor or any other such things. But just in my experience, they need things like Invega, Clozaril, Vraylar, Latuda. Those tend to help those with serious mental illness. But keep in mind, what works for one does not necessarily work for another. You can have two people, identical symptoms, everything. Give one medication and it works beautifully like a charm. The second one, not at all. So you have to work independently to see what they can do. Okay, cognitive therapy helps to rebuild their brain, just like lifting weights or exercising. And exercising is excellent for them. Get them out where they're walking, they're running, they're doing exercise. It really does help with rebuilding the brain. And addiction treatment. Now, you didn't mention it beforehand. Once you have that LPS, everybody knows they need dual diagnosis. So then you're going to be getting the addiction treatment at that time. Next slide. What I like is if you have not taken the free family to family class, and I think they've gone from 12 weeks to 10 weeks now, sign up with NAMI and take that class. It will empower you with so much knowledge. It's a great class. Join NAMI. You will meet so many great friends who share what you're dealing with. And it will be one of the best things you will do for yourself. So you really want to do that. They also, in their family to family class, they have one of their sessions covers medication. That's one of the best classes on medication, and they keep it up to date with what's out there. So you really, I'm getting a message that it's now 8 weeks, which is nice because some of those classes they could have consolidated. Take it. It's one of the best things you will do. Next slide. Jim?
Yeah, as Gail had said, and I've mentioned earlier, keeping a journal is everything. Not only are we going to keep journal on behaviors, we're going to be keeping journals on medications. When new medications especially are being administered by a doctor, we're going to want to keep a sharp eye out on the behaviors and how they change, and communicate with a loved one to see how they feel on it, if they're feeling better and all of that. And always keep a sense of humor. I mean, I see so many families that just burn out and it's overwhelming and they're depressed. And, there's workarounds, there's solutions. getting help for your loved one is everything. Helping them to get back who they were before they were on a conservatorship is so important. So follow this. If you're being challenged and you don't have the answers, call the public guardian's office, call NAMI, call Gail or myself, and all of us are here for you guys to help you with this. If you have any questions, just don't hesitate. Reach out to your community, reach out to us. We're here for you. The remaining slides are on some photographs about the homeless people. The only thing I'll say about that is you're looking at somebody that could be, who you're seeing here is somebody's son or somebody's father, and really encourage you to see the person and not the behavior. So important to do whatever we can to help our families so that they don't end up on the streets. Set up a special needs trust. If you don't know what that is, you should know what it is.
Contact him.
So that's about the end of it. The last slide says, I'm my brother's keeper. I would like to, again, remind you, in Los Angeles, it pays for a lot of the expenses, like what we're doing today and other things. This is their contact information. If you can take a slideshot of that, please, or just look up NAMI Urban Los Angeles and get involved. If you're in Orange County or some other county, get involved in your own county. They have so much to offer, and support groups, knowledge, family-to-family classes, and so forth. So I think that we're at the end of our presentation here.
Yeah.
This is our last slide. Where are we at now?
Let me just say, if you are donating, if you can designate this for LPS, it goes directly to our program. So we're able to do a lot of advocacy and do a lot of things that we have to do. But Jim, thank you. You did a great job. I appreciate it, as always. Okay.
Also, we have two attorneys from Orange County here with us today, and so appreciated that they care enough about what's going on, not only in their own county, but what other people in other counties are doing. And so appreciate you guys being here. Appreciate everybody that came today.
Would they like to add anything, Jim? Would your attorney?
No, I don't want to mention their name. I think that I'll leave them anonymous. When people ask for referrals, they have their names.
Okay.
But I'll keep them anonymous at this point. I think they would respect.
Okay. We could either, if anybody wants to ask questions, we can answer questions now, or you can take a break. Whatever works best for y'all. Because Connie's going to start at 2:40? Yes. Connie Drexler, and she's got a great, believe me, she is good. She's got a great presentation at 2:40. So are there any questions, or y'all want to take a break?
Hi, I'm Janice. I have a question about the hearing. Our public guardian is going to be at the hearing, but they tell me that I can't be there to offer any input or perhaps set up the 3 questions. My daughter's presenting very well right now. And even the public guardian's office said, ooh, we're not sure this is going to fly in court.
Mm-hmm.
So
give the 3 questions to the public defender or to the public guardian and ask them to please do it. And tell them that you would like to be on the WebEx for the hearing. And Connie Drexler, maybe you can address this, because what the courts want, they don't want hearsay. They want, it has to be like, if you're saying this is what she's doing, then they would take your word for it. But if you say, well, somebody else saw her do it, then they don't tend to do it. She may be presenting well, but if her thinking is she's not in touch with reality, like, I'll give you an example. One person parked his car in the middle of the street. It was a T situation going up, and you had to turn right or left, but it was kind of a little bit of a hill. So he parked his car smack dab so cars couldn't go up to go right or left. And it dead end at both ends. That way it could skateboard down the hill safely. Makes very good sense. In reality, can you do that? No. But a lot of times their reality isn't there. So if you can give those questions to the public guardian and to the public defender and tell them you want to be there to talk at court. And I believe, Connie, are you there by any chance?
I am Gail. Let me jump in here and just, I'm assuming that this question is related to LA County. So let me just
Yes.
indicate that at the moment, all of our court hearings are done via WebEx. So one of the disadvantages that we no longer have is that family members can't just show up in court or walk into court and be observant of the process like they used to be able to. Everything now is on WebEx. Generally, in our hearings, the individuals that are going to testify will be the doctor that is supporting the conservatorship and is going to testify to grave disability. And then the conservatee or proposed conservatee has the right to testify. Usually that's the only individuals that are testifying in our hearings. That is how it's handled in LA County, has been and currently is being handled. You may be able to, if you are being recommended to serve as conservator, we will give you the WebEx connection and ask you to be on for that hearing because the court may have questions for you or they may want to talk to you. But generally at the moment, family is not testifying in those court trials, if there's a court trial or a jury trial.
Okay, thank you. It's actually Orange County, but I understand it'll be the same.
I want to jump in here. I'm sorry, were you not finished? Go ahead and finish if you weren't finished.
Yeah, I have a question that now you are conservator and
Wait, let Jim just finish that first question. Just let him finish that one that the lady asked. Jim?
Well, somebody wanted to know how to donate to NAMI Urban Los Angeles.
Oh,
You can
I
just
thought you
go
were
to,